My name is Stephanie Ortiz. I'm the Director of Nurses for the Skilled Medical Rehab Center, and I've been here for 6 years. And this SMRC is a Skilled Medical Rehab Center where we get clients that are more acute they need more acute care. They're either not medically stable, so therefore we're more of a skilled unit. So we do IV therapies for them, we do TPM for them. They're more medically compromised, and when they're more medically compromised, we have to medically stable for them to be able to participate for them in the rehab. So that's the difference between us being at the Skilled Medical Rehab Center versus the post-acute FINR one. We have our unit is 25-bed unit, and we have our team is like titles. We have 15 nurses right now, and we have like 20 CNAs, and we have 24-hour nursing care. Monitoring in a daily basis all the time is patient care, patient safety, making sure that all our patients, are well taken care of, and we have the 24-hour respiratory care that we have on staff with us all the time. In a daily basis, an interaction with them is making sure, that like I said, maintaining the patient safety, patient care, that all the standards and all the regulations, whatever the patients need, for them to continue being medically stable. My daily basis is making sure that we're following all the physician's orders, the patient's getting everything that they need. They either come straight from the hospital, they've even been really recent from the accident, so a lot of stimulation for them, a lot of either do coma stimulation for them, and like I said, either they're on IV antibiotics, IV therapy, they either come with infections. Most of our biggest thing is getting them medically stable so they can be able to participate with the rehab. A lot of our clients that we get are unresponsive. They're just recent, so a lot of them, like I said, they're still in semi-coma, so they're not very responsive. We do get some clients that either have been in another facility where they medically stabilize them, so when we get them, there could either be a month, but still unresponsive. As a nurse at the Skilled Medical Rehab Center, a lot of it is not only you're dealing with the client, you're dealing with the family to be able to see how they can overpass, because some of them are still in the denial that it happened to them, so you have to not only be a patient advocate, but also be an advocate to the family to try to get them through, the situation, to make them understand that this is a process that they have to go through, and this is what the process is. Some of the process could be slow because everybody's, like I said, every accident is different, every traumatic brain injury is different, and everybody will respond to the rehab, to the brain stimulation different. So it's just every day dealing with them, talking to them, and answering their questions that they have. Why is this happening to them at this point? Why is this behavior then? So in a daily basis, the majority of our family members that we have, clients that we have, half of them or more than half of them, the family members are here every single day. So it's just not only being a nurse for the client, but also for the families. Because we are able to develop a bond with them in a sense that we get to know the family members. Our unit is, like I said, it's a 25-bed unit, and we have the staff that we have and the clients that they're able to take care of. The nurses usually have like 5 clients, and the CNAs usually have like 4. So the acuity of them is so low, so high in them. So we have like so many nurses, and they can sit and interact with the family members. And not only that, we share stories back and forth. We become a family, and therefore we can, when we sit down and talk to the family members, and we can know what they did before. Is this something normal? Is this something that they used to do? That we can identify that is new for them or not. For them to, like I said, they're here. We encourage the family members to be here all the time so they can provide that for us. So they can be here and be part of the rehab while it's happening to the family member, to the client while they're here. You see that when they came in, they were pretty much no response at all. And for them to leave here walking, and almost fully recovered, we had recently, about maybe a year ago, when we had one very young girl, in school about for her college, finishing her college degree, and for her to have a tragic accident, but to see where she came from to where she left walking, and her family member, her mom and dad being very supportive, her sister being very supportive, and letting us be part of that. It's just wonderful. Very rewarding, very rewarding. Every client that we have here, and for them to leave, and for us to be able to help them out, and from what they come to where they leave, very rewarding to see them. Because some of the clients that we have, the accidents that they have, you never wish it on anybody to happen, you know. And then when they come here, and like it's we have a lot of the clients that we have, the family members that come, they've been referred by another family member that happened to them, and they're like, this is where I went, and this is, you know, what we had, this is the results that we have from there.